Doctor, thank you for joining us. We're talking about exercise and fitness. The first question people are going to ask, what is the least amount of exercise I can do and still be effective?
There's two organizations that make guidelines for healthy adults for how much exercise they should do. And the simple answer to that question is at least 30 minutes, 5 days a week. And that comes from the American College of Sports Medicine and also the American Heart Association. Now, any basic exercise program is going to have three components: cardiovascular exercise, strength training, and stretching. That guideline is mainly for the aerobic exercise, the cardiovascular exercise. And you want to be able to do 30 minutes of moderate intensity physical activity at least 5 days a week. So what's moderate intensity?
Well, that's what I was going to ask. What's moderate intensity? Let's define that.
There's a few ways to define it. There's the more scientific way, if you will, and the more subjective way. And the subjective way works well for probably most people. If you grade exercise, the intensity of exercise on a scale of 1 to 10, 1's really easy, 10 is very difficult, you want to exercise at a level of about 5 or 6 out of 10. That's moderate intensity exercise. If you do intense exercise, you're working out at a level of about 7 or 8. Below that level, you're not challenging your heart enough to get the benefits of aerobic exercise. You can also do something called the talk test. The talk test is a subjective measure of exercise intensity, and it goes like this. When you're exercising, you should be able to just about carry on a conversation with somebody, almost out of breath. If you cannot carry on a conversation with somebody, you've crossed the anaerobic threshold. You're working out now at a high level of activity. Whereas if it's just so easy to do your exercise that you're not even getting to the point where you're panting, you're probably not working out hard enough.
Well, let's put this in the context of things, the practical things people can understand. Where does a brisk walk fit?
Brisk walk is a classic moderate intensity physical activity. And with that, you want to be able to, you'll find that if you do brisk walking, which is not just a casual stroll, but you actually swinging your arms more, getting your elbows up, walking at a little bit quicker stride frequency, that you would get your heart rate up into that zone of about 50 to 70% of your maximal heart rate, or on a difficulty scale, you'd probably be about 5 or 6 out of 10.
Let's say I'm suddenly stricken with a sense of exercise rectitude. I haven't exercised in a long time. What's the best way for me to get started?
If you're over 40, always a good idea to get cleared by your physician. Talk to him or her before you start an exercise program. If you're having symptoms right now which limit you from doing physical activity, shortness of breath, chest pain, pain in your calves when you're walking, you need to see the doctor before you start a program. Most people, it turns out, are going to be able to be cleared for at least moderate intensity physical activity. And for them, the guidelines are, as we said, 30 minutes of moderate intensity physical activity at least 5 days a week.
Okay. What are the typical mistakes that people make when they start an exercise program?
There's a few. One is that people will try to expect results too soon. So it takes at least 12 weeks to start noticing changes from physical activity, especially if you want to look in the mirror or check the scale out. If you expect to see results within a few weeks, you're going to be disappointed that you haven't seen them. Another thing is trying to do too much too soon. People are always ambitious when they start a new goal, and weight loss is often the motivating factor for exercise. Many people, they want to see results, they want to see instant results, and they're willing to put that extra time in that first week. But by the time the third, fourth, and fifth week roll around, you sort of drop off in your level of commitment. So doing too much too soon is a problem, expecting results too quickly. Another thing is choosing something you don't like doing. Adherence really involves consistency. You have to pick something you like. So you don't want to force yourself to do a type of activity just because your friends are doing it or because you think it's the best type of workout to do. Maybe it's a trendy one that you've seen on an infomercial. You want to stick with something that you just like doing, whether it's biking, swimming, jogging, hiking.
Okay. What are the real benefits to regular exercise other than, for most of us, we want to look better?
Yeah. Exercise has got a variety of benefits beyond what you just see in the mirror. Exercise will lower your resting heart rate and your blood pressure. It reduces the chance of several chronic conditions. People that exercise are less likely to have diabetes, heart disease, high blood pressure, less likely to suffer a heart attack or stroke. Exercise is also valuable because it elevates mood.
Which exercise is more important, strength training or aerobic exercise?
It's important to view those exercises as complementary, not really one is better than the other. They perform different functions in your exercise program. You get different benefits from them. The aerobic exercise is going to raise your heart rate. It's going to make your lungs work harder. That's the exercise that lowers your risk for high blood pressure, diabetes, heart disease, and it is exercise that you should do most days of the week. Strength training builds your muscles. It also makes your bones stronger. You are less likely to fall if you do strength training, resistance training, the type that you do with weights. And if you do fall, you're less likely to break a bone. So those two types of exercise, you want to do both. With strength training, only about 2 or 3 days a week is all you need to do it.
Okay. Well, if you could only suggest 3 exercises, what would they be?
For strength training, if you want to get the most for your money, kind of do efficient exercises, compound movements. That's where multiple joints are being used at the same time. So for your lower body, a good exercise would either be the squat or the lunge. The squat activates your quads, your butt muscles, and some of your core muscles. With that exercise, you start from a standing position, and you imagine kind of sitting and coming back up. You just take your thighs to parallel, go back up, make sure your knees don't drift beyond your toes. And that exercise is one of the best exercises that you'll get to just do your lower body. You only need to do about 8 to 12 repetitions, and you can do a set, 2 sets, or 3 sets.
Is that aerobic or strength?
That is a strength training exercise.
Okay.
For aerobic activity, the simplest and most common form of aerobic exercise is walking. Walking requires little or no equipment. You just need a comfortable pair of shoes, shorts, or loose-fitting pants, and just need to get outside and do it, or you can do it on a treadmill.
You see on TV, if you watch more than 10 minutes of TV, you see the commercials and the infomercials for miraculous pieces of exercise equipment. Are any of them worth the price?
I like suggesting about 4 home pieces of equipment that are all less than $30. A yoga mat, a balance ball, a pedometer, and also just exercise tubing. Most of those devices that you see, especially the ab devices, you really don't need them. Some people like buying them because if they use an ab machine, maybe they're more likely to do their ab exercises. A crunch is free. You can just do it right on a yoga mat. It works every bit as well as any of those ab exercises, and you don't have to spend the money for it. The exercise tubing, which you can get a group of 3 exercise bands for less than $30.
Explain what exercise tubing is.
Exercise tubing, you can think of them as big rubber bands, and they're a way to strengthen your muscles and do various exercises and provide resistance right in your home. For example, you can take one handle, usually it's tubing that has a handle on either end. You can put the end of one handle underneath your foot. For example, your arm can move the other end and you can do a bicep exercise. Turn it around, put it over your head, now that becomes a tricep exercise. If you put the tubing in front of you, pull away, you're working your back muscles. If you put the tubing behind you and push forward, you're now doing your chest. So very efficiently, you can go through all the major muscle groups, especially in your upper body, but also your lower body. It's portable, it fits in a drawer, you can take it on vacation with you, it's inexpensive, and it's a way for people to get a good strength training program right at home. The yoga mat gives you a nice cushiony surface to do exercises, especially stretching exercises, but also some resistance exercises, and it's a surface that you can wipe and keep clean. The balance ball helps you work your core muscles, helps you work balance. You can buy a stability ball for less than $30, and it can also provide a surface to do strength training exercises. The pedometer is a great way to gauge how much cardio you're doing. Again, if you stick with walking as your main form of aerobic exercise, it's easy to keep track now of how many steps you take. If you walk 10,000 steps a day, that's about 5 miles, and that's really the goal for a lot of people, is to try to do about a 5-mile work up to where they can do about 5 miles of walking.
Very well. Thank you very much, Doctor.
Okay. Thank you.